This is a recording to talk about how Adam can help CCGs and local authorities get more from their provider management activity using our provider management tool. So let's get started. So provider management is a fundamental part of commissioning, and it's even more critical in areas such as continuing healthcare, general healthcare settings, and indeed social services, particularly given the nature of the provider market. It's large, it's complex, and there's huge budgets at play. And it's part of the reason why NHS England is increasing their focus on it in the National Programme for Continuing Healthcare. But when we travel around the country and talk with CCGs, it's a fairly consistent message back. You have large provider markets, limited time available, a lack of resource in teams, and lots of data. And so whilst we all want to do more, it can be very, very difficult. And it might be more than that. Some CCGs have concerns around sustainability, particularly in the domiciliary care market. It might be that you want to work more closely with neighbouring authorities or CCGs. There's a whole host of reasons that might be holding us back from getting the most out of our provider market, ultimately restricting the benefits that you can receive, as well as your patients and your service users. So that's why we built our provider management tool. We set about to try and build a solution with our NHS partners to overcome these challenges, with very specific outcomes that we were looking to achieve. Number one, to save time. Number two, to support proactive work undertaken by our partners. Number three, to improve engagement between commissioners and the local provider market. And fourthly, to provide greater insight. And ultimately, by combining those four benefits and putting them all together, looking to achieve improved performance from your provider market. So we'll just quickly introduce Adam. We provide a digital CHC solution to the healthcare market comprising of a range of different product areas, and provider management is a fundamental part of that. So whilst we provide workflow tools, database systems, financial products, the provider management tool is a fundamental part of any commissioning program. And if we can improve provider performance, we can see great benefits both financially and in terms of non-financial aspects. So in terms of how it works, the first thing we need to do is get providers onto the Adam system. And it's a fundamental part of the product that providers engage with you via the same tool that you use to manage the provider market. So therefore, the first thing we do is put a team together to engage with your local providers and get them all on board ready for launch. And that might be via a series of face-to-face events, webinars, communication plans, social media, whatever it takes, but we're there every step of the way to make sure that your local providers are able to quickly and easily get onto the platform. And secondly, the thing we need to do is define what information we want to capture as part of their application process. So we can use that opportunity to make sure that every provider that comes on board, we're able to create a unique profile for each one of them, containing all of the information that you need on which you can base your future provider management activity. We'll store that information within their unique profile and make sure that any future activity that you undertake with regards to that provider is stored within the same place, making sure that all of your provider information is stored online in an easy-to-use, simple profile. And in addition to that, we'll configure the system to make sure it meets your local needs. So it might be that in your area, you want to recheck local insurances. You might want to gather organisational charts from your providers, or simply update your records about the particular care homes in your area. All of that is configured within the profile. So as the applications come in, we're populating the profile with information that's relevant to you. The next step after gathering those providers online is agreeing consistent process and policy with you. So we will reflect local policies within the system as well as your local processes. So it might be that you have an existing policy that you don't want to change, or you want to update your policies. You may want to launch a new monthly questionnaire or quality assurance framework. We'll take all of that information and embed it within the platform. And if you're struggling with a particular area, we'll use our expertise and experience in other areas to bring you best practice and see whether they've got other policies and processes that you wish to adopt. So not only does the tool store your providers, it captures all of the information in one place. And it allows you to interact with them online. So really critical part of the provider management tool. And that's extremely powerful. So it might be that we want to collect monthly quality returns through the tool. It might be that you regularly want to share best practice documents with a single provider or multiple providers, whether that's capturing notes from a meeting or a monthly call that you hold with a care home, or even set tasks with very clear milestones and deadlines for providers to deliver, say, a performance improvement plan. All of that can be facilitated through the Adam tool, meaning that it's a one-stop shop for all management activity across your entire provider market. And finally, with regards to reporting, so we've taken all of the providers online, created a single profile for each of them, and now we're managing our providers on a day-to-day basis through the tool. Importantly, we want to provide you insight and information through the platform. So if you tell us what reports you want, we can make sure that we capture all of the information needed to systemize those reports for you. And they can be accessed directly from the system or indeed automatically sent out. So for example, if you'd like to know general activity by a particular provider or all of your providers on a daily basis, that can arrive in your inbox at 8 a.m. every morning. If you'd like some more complex analysis, that can be systemized. And for the most detailed reporting and sophisticated reporting that we do, we also use our own business intelligence tools to provide that for you through our teams on a monthly basis. So we have an online platform with all providers in a single place to manage them on a daily basis and to provide you greater insights. And that's a really powerful tool. We set out when we built the tool to save staff time, give insight, and ultimately lead to improved provider performance. I'm delighted to say that's exactly what we've done everywhere we've deployed the tool so far. So let's just explore that a little bit further. Firstly, how could this save you time? Well, as we've covered, all providers are in a single place. So no more do you have spreadsheets flying around, looking through your inbox, through your sent items for things you've shared, asking colleagues to send a template over that they've used previously. We have all information in one place in a secure online platform. You can access it through any mobile phone, tablet, laptop, on the go, and the information will be in your hands immediately. And importantly, your providers are on the other end of the tool. So when you want to ask them something, you can just send them a message through the system. If you want to share a document or ask them to complete a form, that can all be done via the tool as well. It's quick, it's easy, and it's all captured in one place. The system goes further though. It also automates basic tasks to save you and your colleagues time. So it can monitor when documents are due to expire. It can send reminders to providers or even customer users to complete outstanding tasks, and it evaluates data that's captured. We want to provide a technology platform to do the basic tasks for you so that you're free to do more valuable activity. And it also allows collaboration, not only with providers and not only across teams, but indeed across organizations. So CCGs and local authorities are likely sharing providers with each other across a particular region. And we're able to open up the platform for multiple organizations to collaborate and to share those providers online. So we may see an example in a particular area of a local authority, say, suspending a provider due to safeguarding concerns, but not informing, or at least not immediately informing the CCG and putting patients at risk. This tool stops that. It makes those decisions on those tasks instantaneous. And we can flag, send emails, and raise awareness of issues in the local provider market. In terms of gathering insights, saving time is fantastic, but we want to know the market better. If we understand our provider market better, it's easier for us then to improve performance. So as we've touched upon, we capture all of the information you need. Staff or providers are prompted to enter information on a scheduled basis where it's part of your policy. Or we can load information that you already hold, which can be extremely useful. Or indeed, you can make use of our third-party integrations. If you'd like CQC information stored within your platform or financial assessments of providers, all of that's fully automated. So we capture the information so that you don't have to. We then automate generation of reports based on your very specific needs. So if you want to know activity reports about providers, simple, we can schedule that for you. If you'd like more detailed reports against a series of KPIs, how providers are performing in terms of workforce or health and safety, we can automate that for you as well. And as we've touched upon, we have a team in our business using BI tools all day, every day, analyzing complex data and providing complex reports on a weekly or monthly basis. This allows you to understand and explore provider performance in your area like never before. And as a topical time with the COVID-19 crisis, we recently amended the tool to quickly check for infection rates and mitigations in place across all of our customers. We saw a brilliant response from providers. All of the information gathered across 4,000 care providers was compiled into a daily report, simple to use, that was sent out every morning to our customers. And ultimately, as we've said, this is to improve performance. So you've gathered the data, then what? Well, it might be that once you've interrogated the data, there might be a number of providers who look to have a particular problem, for example, higher than expected falls given the size of their care homes. Well, the system can be used to automatically send out best practice documents, to ask them to share information online themselves, indeed to prompt them for monthly written updates for your review. And then we can then check the results to see whether that's had an impact. Or you might want to arrange an event and invite the 20 poorest performing providers in a certain area like infections. That's easy to do. Quickly pick the providers, send out details of the event and ask them to confirm. And then afterwards you can share slides and notes and whatever it may be with providers and ask for feedback, all in one single place. So just to recap, the tool is there to save time, gain insight and improve performance. Just by way of one quick example, in 2019, an integrated care system adopted the Adam solution for 3 very clear reasons. Firstly, to create a single consistent platform for all quality and contract management activity. Secondly, to save time spent on data collection and evaluation. And thirdly, to improve performance in certain parts of the region. And it's gone very well. We've managed to enroll all local providers to the platform successfully, over 300 in total. On a monthly basis now, as well as occasionally on a weekly basis for ad hoc reports, all data returns that the 11 member organisations require are gathered automatically and evaluated by the system. No longer do members of staff have to sift through 300 plus spreadsheets on a monthly basis and compile them into a single data record. And indeed, providers who supply services to multiple organisations simply have to log onto the platform once a month and fill out one template, and that's their work done. On an ongoing basis, all quality and contract management activity across the region is supported through the Adam tool. So there's a single, consistent process and policy across the entire integrated care system, which is fantastic for providers to fully understand what they need to do to demonstrate and improve their performance. We've seen consistently high engagement and support by the local providers who have fed back that the system is incredibly easy to use. The support from Adam has been first class, and they much prefer using the tool for engaging with the organisations in their region. And finally, and excitingly, we've seen great improvements in performance in the first 6 months of the contract, not just in terms of how the tool is being used and data being gathered, but actually in terms of the quality of care delivered to local patients and service users, whether that be in falls or infections or other metrics that we measure in KPIs. There has been a noticeable and meaningful increase in performance since the Adam tool has been deployed. So that's our introduction to Adam's provider management tool. If you'd like to learn more, please visit our website at www.useadam.co.uk. There's lots of interesting news and resources for you to review. Or if you'd like to discuss how we might support your provider management approach, please email us at inquiries@useadam.co.uk. Thank you very much.